Welcome to the topic Anxiety and Insomnia. Anxiety is a state of apprehension or tension or uneasiness that stems from the anticipation of the danger, and it is the source of which is largely unknown and unrecognized. Anxiety disorders are classified into several categories. Number one, generalized anxiety disorder, which is difficult to control and excessive anxiety that lasts 6 months or more. It is the most common type of the stress disorder, and the symptoms include restlessness, fatigue, muscle tension, nervousness, inability to focus or concentrate, an overwhelming sense of dread, and sleep disturbances. Sweating, blood pressure elevation, heart palpitations, varying degrees of respiratory change, and dry mouth is also the symptoms of the generalized anxiety disorder. Then is panic disorders. In this, we have the intense feeling of immediate apprehension, fearfulness, terror, or impending doom. Panic attacks usually last less than 10 minutes. Patients may describe them as seemingly endless. As many as 5% of the population will experience one or more panic attacks during their lifetimes, and women are affected about twice as often as the men for the panic disorders. We also have some other types like phobias, which is a fearful feeling attached to subject, object, or situation. PTSD, which is called as post-traumatic stress disorder, response to re-experiencing a previous traumatic life event is called as PTSD. Then we have OCD, which is called as obsessive compulsive disorder. It describes recurrent, disturbing thoughts or repetitive thoughts, behaviors. There are some specific regions of the brain which are responsible for anxiety and wakefulness. And those brain regions are, number one is the limbic system, which is an emotional expression, learning, and a memory region. We have reticular formation region, which is for the network of neurons along entire length of the brain stem. And stimulation causes the increased alertness and arousal, that is for reticular formation. Other brain regions, we have reticular activating system, which is also called as RAS. It controls the sleep and wakefulness of a person. It helps focus the attention, and it is responsible for anxiety and fear. Now, management of anxiety. We do some non-pharmacological ways like behavioral therapy. We can do biofeedback. We can do meditation. We can do some other complementary therapies. And also, we should reduce caffeine, reduce stress, and alcohol consumptions. Then pharmacological treatment includes the name of categories of drugs like anxiolytics. The drugs that we used for the seizures can be used for the anxiety as well. Antidepressants can be used, and some cardiovascular medications are also used for this one. Now, this is telling you about how our anxiety works. When the stressful event occurs, we have a short-term anxiety. Either you change the way you think, then it will change to the normal behavior. If the short-term anxiety leads to the fearful feelings, either we should eliminate the cause, which is causing the fear. Otherwise, we're going to change the mental condition, and that fearful feelings will further go into the increased activity of the lack of sleep. Now, when there is a lack of sleep, we can use medications, and it can be to the normal behavior. If we are not using medication, if you're not getting better with medication, then it starts with the unusual behavior of a human, and then it takes the shape of the anxiety and the related symptoms on the longer basis. First, let's talk about insomnia. Insomnia is inability to fall asleep or remain asleep. We need for sleep. We give body time to repair because sleep is a protective mechanism and electrical charging and discharging of the brain. Brain needs to process and file new information. So when we're talking about sleep, let's understand about 5 stages of the sleep first. Stage 1, which is called as NREM sleep. It is for 5 to 10 minutes. Very light sleep. Our eyes are always closed, can easily be awakened in that one. Muscle activity slows down. and may have the sensation of the falling. Stage 2 sleep is NREM sleep. It's for 20 minutes. It's a light sleep. Body temperature drops at this time. Heart rate slows at this time. And body gets ready for the deeper sleep. Stage 3. Again, it is NREM sleep, which is the transition to the deep sleep. It is extremely slow brain waves interspread with smaller or faster waves. Then we have stage 4, NREM sleep. It lasts for 30 minutes. It's a deep sleep phase. It's difficult to walk. Body has very little movement at this time. Repairs and rejuvenations occur. Muscles, bones, and tissues are getting rejuvenated in this sleep time. Then is stage 5, REM sleep. It is lasting from 10 minutes to 60 minutes. It is the deepest sleep phase. It is rapid, shallow breathing occurs in this one. Muscles are temporarily paralyzed. And when the most dreams occur, this is that part. This is showing you a graph that how sleep changes as we age. Stage 1, stage 2, 3, and 4 sleep pattern of a young person. Hours of sleep is he stays more in the stage 4 than in 2 hours of sleep, then 3, 4, like this. How the age is increasing. A young person is taking a stage 1, 2, 3, and 4 in which pattern, and in an elderly patient, how the sleep is going to be decreased and they are more in the stage 2 phase rather than in the other phases. Now, we do get some different types of the sleep disorders, and from them, the 5 are the common types of sleep disorders. Number 1 is called as insomnia, which is difficult falling asleep or staying asleep. Another is sleep apnea, in which the breathing repeatedly starts and then stops. Hypersomnia, the feeling exhausted after 8 to 10 hours of sleep. Narcolepsy is irregular sleep-wake cycles. And parasomnia, abnormal or unusual behavior during the sleep. Then what defines insomnia? One of those sleep disorders. Problems falling asleep is one of the insomnia. Waking up too early, that is also insomnia. Having trouble falling asleep again, that is insomnia. And lack of rest after sleeping. When you wake up, you say, my body is tired. That is insomnia. What causes insomnia? Stress, irregular sleep schedules, lifestyle, neurological disorders, physical pain. It doesn't allow you to sleep well. If you're on some medications, they have a side effect of insomnia. Some mental health disorders also disturb you and doesn't let you sleep better. With age, we already see the graph that it affects with the age. In pregnancy, you are always restless, and there are some other sleep disorders as well. What are symptoms of insomnia? Difficulty getting to sleep. You are on bed, you're trying to sleep, but it's not letting you sleep. Forgetfulness. Now, when you don't take the good sleep, you forget the things. You start making the errors. Daytime sleepiness. In the daytime, when you're doing something, you want to sleep. You can't concentrate on anything. It's a poor concentration. Difficult waking at a normal time. If you always wake up at a specific time, it's hard for you to wake up at that time. You start getting tension headaches and waking up during the night and having the trouble going back to sleep. Irritable, grumpy mood, and waking up too early, like 4 a.m. You are awake still until from 4 a.m. So that is a symptom of insomnia. Now, if that happens and goes further, what are the risks of insomnia? Reduced concentration, shorter life expectancy, impaired memory that we discussed. It can also lead to depression. It can also fall for accidents while you're driving. It lowers your immunity, and definitely it causes the obesity. Now, we have 3 different forms of insomnia. One is transient insomnia, which is characterized by only brief periods of the poor sleep, perhaps a night here and there. Acute insomnia, it is when the person has persistent sleeping problems that last for more than 3 weeks. Chronic insomnia, it lasts for extended periods of time. Now, we have some natural remedies for insomnia before we go for pharmacological. So these are also called as non-pharmacological treatment for insomnia. Set a sleep schedule. You sleep at same time, you wake up at same time. You should exercising daily. Tame sleep anxiety. Try some relaxation techniques in your life. Make your room sleep friendly so you can have a better sleep. Sleep apps are there nowadays. You can try them for meditation, for relaxing yourself. Eat some sleep friendly fruits, like before you sleep, you have a snack so that you should not be feeling hungry. Consider acupuncture. If you're really feeling hard time, you can go for acupuncture. You can do some meditation techniques, and you can also do some yoga. It also relaxes your brain. Other than that, we have also some insomnia treatments showing us as an initial step when we do some lifestyle adjustments that include an improved diet, regular exercise, and healthy habits. There are two levels of treatment. Again, alternative medicines as herbal supplements, phytoestrogenic supplements, or hormone regulating supplements. And in pharmaceutical, we can use antidepressants, we can use benzodiazepines, and we can use HRT as hormone replacement therapy, but it is linked with the serious side effects for sure. If we talk about the further treatment of insomnia and anxiety, anxiety and insomnia, they both are treated with different types of the central nervous system agents. The drug classes includes antidepressants, which can be used for insomnia as well as anxiety. They include alter norepinephrine and serotonin in the brain. For example, SSRI, that is selective serotonin reuptake inhibitors, tricyclic antidepressants, and MAO inhibitors. We have some CNS depressants also, more that is benzodiazepines. We have barbiturates, which slows the neuronal activity, and they're also called as the sedatives or sedative hypnotics. The CNS depressants, their long-term use can lead to the physical or psychological dependence. And as we already know, the physical dependence is when the body needs the substance to maintain the status. And psychological dependence is the emotional and cognitive compulsion to use a drug. So if you think about a word compulsion, it is an uncontrollable urge or a desire to repeat a behavior or action. If you start using the CNS depressants, its withdrawal can cause the life-threatening neurological reactions. It can cause fever, psychosis, and seizures. It can cause increased heart rate, decreased blood pressure, loss of appetite, muscle cramps, impaired memory, concentration, blurred vision, anxiety, and other withdrawal symptoms as well. So we should be taking care of not to take these CNS depressants unless we don't need them. And these withdrawals can last up to 2 to 4 weeks. Now, these antidepressants also reduces the symptoms of panic attacks and anxiety disorders. So panic symptoms includes anticipatory anxiety, physical symptoms, shortness of breath, rapid heartbeat, muscle tension as well. Now, when we use the treatment, in the treatment strategy, we face the fear and suppress the symptoms. We use the drugs which lessens the negative thoughts. We decrease the neuronal activity and suppress the functions of autonomic nervous system. And the goal is to remain calm and engage the self-help skills. We also use some, as we discussed, antidepressants, which is used to reduce the symptoms. We use some CNS agents like SSRIs, selective serotonin reuptake inhibitors, SNRIs, selective norepinephrine reuptake inhibitors, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors may also be used for this one. But they also have some common adverse effects if you are using the drugs. Those includes headache, insomnia, nervousness, dry mouth, dizziness, weight loss, sexual dysfunction, and chills. Another, we were talking about benzodiazepines. They are also useful for the short-term anxiety treatment and for insomnia. So benzodiazepines, they are the most widely prescribed drugs. Their mechanism of action, they work binding with the GABA, which is a gamma amino butyric acid, and intensify the effect of natural inhibitory neurotransmitter, which is present in the brain. So GABA is nothing but an inhibitory neurotransmitter. Benzodiazepines uses, they're helpful for panic disorders, for generalized anxiety, for phobias, and insomnia. Then we have barbiturates. They are the powerful CNS depressants, and they also act by binding with the GABA. They are used to be the drug of the choice, and they're rarely used for the treatment of anxiety or insomnia. They have the significant side effect. That is why they're rarely used, because they have psychological and physical dependence, and that is very much high. So we do not use too much of the barbiturates as a first choice of treatment. And the overdose also results in the respiratory depression, hypotension, and shock. Now, there are a few drugs for treating the anxiety and insomnia in a form of a chart, like atypical antidepressants, mirtazapine, atypical antidepressants, reversible inhibitors of monoamine oxidase A, moclobemide, barbiturates, phenobarbital, primidone, benzodiazepines, alprazolam, clonazepam, diazepam, flurazepam, lorazepam, nitrazepam, oxazepam, temazepam, triazolam, benzodiazepine receptor agonists, zolpidem, zopiclone, central nervous system depressants, buspirone, monoamine oxidase inhibitors, phenelzine, phenylcypromine, serotonin, norepinephrine reuptake inhibitor, SNRI, is the drug duloxetine. SNRI is also venlafaxine. Serotonin precursor L-tryptophan. SSRI is citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, sertraline. TCAs, tricyclic antidepressants, is desipramine, imipramine, and tricyclic antidepressants is clomipramine. That's it for the chapter Anxiety and Insomnia. Thank you.